Good evening. Thanks for joining us. I'm Tony Lopez.
And I'm Elizabeth Kling. As hospitals start to run low on beds and testing sites are overrun, there are new concerns about people unknowingly spreading the virus.
So should people without symptoms be tested? CBS 13's Renee Santos is live in Sacramento getting answers for us. Renee?
Yeah, Tony, there's new research that suggests that super spreaders are people who are asymptomatic, could be to blame for a lot of these cases. And so should people then who aren't showing symptoms be tested? We asked the governor that exact question, and while he didn't give us a direct response, he did give us a hint to changes when it comes to testing. Cases on the rise across the state, many tracing back to people not following the rules, some unknowingly infecting others with the virus because they themselves don't feel sick. We went straight to the governor to ask how to get a hold of the increase in cases that link back to people who are asymptomatic.
Can the recent increase in cases be attributed to the super spreaders? And should people who essentially aren't showing symptoms, should they be getting tested?
At first, Governor Newsom wouldn't answer specifically, but did hint towards changes in testing.
I'll be putting out different frame of engagement on the testing that will go more substantively and specifically to your question, because we are now looking to really target and modify our testing criteria.
He later gave us better detail.
We're working to match some of our testing capacity with local labs with many of our hospitals, and not just doing these national labs where you're seeing a lot of the delays occurring.
Dr. Philip Norris, an infectious disease expert, says testing overall is necessary.
If we don't have enough testing to test everybody who's symptomatic, and as I said, those targeted groups of asymptomatic people, we'll have cases running around that we don't know are there and could be spreading. So adequate testing is going to be absolutely key.
But can people without any symptoms even be tested as counties across the state deal with a testing supply shortage? We checked out Project Baseline, and turns out they can. It's a relief for many.
And it should be available to everybody anytime they want it, because you never know. If you have it, if you're asymptomatic, you're not going to know.
I think more testing is a good idea, that's for sure.
Now, many of those tests are processed through Quest Lab, which is currently already at capacity, which is why many people are waiting more than a week, even longer, to get their test results back. We're expecting Governor Newsom to give us more details about those changes to the testing protocol later this week.